Well, welcome, and I am your host, and my name is Britton. Today, I just wanted to get on here before we start our conversation and let you know that I am not a psychologist or a psychiatrist. I speak to people that are in those professions, and this channel is for information only. Hopefully, it's good information that you can apply to your life. So, as I speak to those guests, and if you feel like you want to support any of those, some of them are authors, blogs, mental health advocates. They have foundations, not-for-profits. If you want to support those people, I'll put the links in the description below. Also, if you'd like to support the Suicide Monk podcast and help keep this moving forward, I'll put that GoFundMe in the link below. I'll put the link down there for the Ashes to Life coaching as well. And don't forget to like and subscribe. It helps us keep moving forward. And any prayers, lifting up, good vibes, we will take them. Thanks a lot. Again, we'll see you on the good side. Well, welcome to the Suicide Monk, and my name is Britton. Today we have to have Dr. Paul Corona from Southern California, right? Is that San Diego area? Is that where you're at?
I'm in Orange County, so it's kind of between LA and San Diego. Yeah.
Nice. Yeah. Orange County Choppers. Used to watch that all the time. So Paul, you're in the medical field, but you transitioned from medicine to psychiatry, or do you practice both still?
I'm a trans. So no, I started in family practice. So this is back in the early 90s. Back in medical school, in the late 80s, I didn't really know exactly what I wanted to do. I knew I was thinking pediatrics, adult, OBGYN for a little while. I didn't really know for sure. I liked everything, but then I had to make a choice at the end of med school. I liked psychiatry, but I didn't think I wanted to do anything full time. So I chose family medicine because I thought it would give me like the best of all worlds, and that I would be able to practice, just different things, and just I thought it would just be interesting to. And so I started my practice in 1992, and I loved being a family doctor. I loved everything about it. But during the 90s, I got really interested in psychiatry because new medications were coming out that were really exciting and that I hadn't seen before, back in training days. And so during the 90s, I got so into it. I started developing a reputation. I got getting a lot of referrals. And then by the end of the night, going into 2000 or so is when I had to make a really tough decision because I was getting like way too busy and I was spending way too many hours at the office. And so I had to make a decision what to do. And so I chose to forego family practice and move full-time into mental health, or what I call mind-body medicine. So still incorporating what I learned as a primary care doctor about the physical characteristics of mood, but I took it to a different. So it's a very unusual story. I don't know any other family doctor that's done this, but since then, about 20 some years now, all I've been dealing with is mood disorders like depression, anxiety, bipolar, et cetera, et cetera. So that's kind of my story in brief, but it goes further if you want to go further into my other
Absolutely
about the books and stuff.
Yeah, absolutely. Very, very interesting content that you've come up with, and that mind and body and how that connects to each other. So one of the things that I've talked to a lot of people about is the body remembers, and that's the traumas that we have. And, the body will react. Honestly, it seems like before the mind even catches up. You're already reacting physically before the mind catches up. So I'm assuming that's where your books are kind of in that neuroplasticity, and changing the response system and giving way to new ideas throughout the system. You want to tell me about that? That's the mind body healing books that you've written. You've written 3 books in that series, right?
Right. And I like what you said there about the body remembers. So yes, what I discovered early on, and when I even in training, one of my attending physicians said, Paul, you're going to notice in your practice that half of the people you see are there because of they're either stressed out, they're depressed. And I started to notice that he was right about that. And then what I started to see too, was that people would come in with pain conditions, fibromyalgia, irritable bowel syndrome, joint pains, headaches, neck, and everyone can kind of relate to this area right here: shoulder, neck, back. And so I started to see, and especially there's a new medication that came out in 1993 called Effexor XR. So everyone's heard about SSRIs like Zoloft and Lexapro. So the Effexor was the first SNRI, so not just working on serotonin, but also norepinephrine. And that's when I started to see this connection, because I started seeing people coming in and saying, "What in the world did you give me?" And I go, "Why? How is it different than that Zoloft you were on before?" Well, geez, my anxiety is better. And you know what? I haven't had any headaches. My stomach is better. My chest, I don't get the chest pain. So I started to see this linking between the emotion and the body. And I think I recognize it as a family doctor. I think psychiatry, by and large, has not recognized it because they don't really focus on the body. They focus on the brain, and they forget about the body. That's not their training. And I think primary doctors, we focus on the body, less on the brain, because that's our training. So I think for me, I kind of started to put two and two together. So early, I think about 2002 or 3 is when I started writing my first book, because I thought, what I'm seeing here is revolutionary, and I'm not reading about it. I'm looking at journals. I'm trying, when I go to lectures and ask questions, and as people don't seem to see this happening, what's going on, I was confused as to why, it's like, I can't be the only doctor seeing this. Come on. I mean, so I started realizing that I needed this. I thought, who's going to believe me unless I write a book about it? And so I started writing, and after 4 years of writing, I was at 800 pages, and I thought, this is too much for one book. So I said, okay, let me finish the first book and let's move into the second book. And then after writing for 4 years on the second book, another 800 pages. And then I thought, okay, well, too much for another book. Let's make it 3 books. So the 3 books are about 1,200 pages long total.
Nice.
And that's my first series, Healing the Mind and Body, called the Trilogy. And then, if you want to keep my writing journey going, I then wrote 2 books after that, what I'm working on right now, which are books for doctors, because I plan on teaching primary care doctors in the future. So now I'm editing 2 books for doctors before my most recent book came out.
And that's the Corona Protocol.
Yeah, my most recent book is, I think, my best book is the Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. So this is the book that kind of brings it all together. I wanted to do this book differently. I wanted to tell stories. So this is really a 30 original short stories about people that suffer with different types of conditions. And so some of them are based on real patients. Some of the stories are just from my imagination. But I wanted to, make it different than my first 3 books, which is more the science, and then make it more about people's stories and experiences.
Nice. Yeah, I love that. I read that. So is this like a follow-up kind of inspiration to the 3 books, or? Yeah.
I think it's that, and I knew I wanted to write one more book, and I thought I'm a fiction reader. I've been a reader my whole life, and I love reading. So when I'm not writing, I'm reading, basically, and I just wanted to. Since I love fiction so much, I thought, and I love storytelling, and that's what I really decided I wanted to make a book, which is basically about that half fiction, about half nonfiction. So that's what kind of drove me, is because of my desire to be an author. I also want to write a fantasy novel, fantasy series at some point. I'm just not yet. I need a break.
Yeah, ambitious.
I'm tired of writing, and I'm tired of editing. I'm tired of writing, and after I release these two last books, I'm going to take a break from writing for a while.
Yeah, I understand that. The artistic. It kind of gets stifling after a while, and you got to got to move in a different direction and
Yeah.
maybe even learn something new.
Right.
That's what I started doing, is just learning. Well, I started learning Spanish, and now I'm taking school again. So it's,
Right.
those things are sparking inside of me that, I want to educate myself and learn and continue moving forward and learning to live in a better way and more educated way and things like that. So it's inspiring for just myself to feel that energy coming through me. And yeah, beautiful. So what do you prescribe medicine still? And so two questions.
Yeah.
Do you prescribe still? And what was your experience with these? Because I've had experience with depression meds
Mm-hmm.
and Effexor in particular, where it came out. Very numbing for me, like emotionally numbing.
No.
And so how have you seen that help people heal? Because I was tired of not feeling. I'd rather feel the pain that I feel than nothing, because I still had the suicidal thoughts. I still had the same turmoils and pains. It's just I was like, meh,
Yeah. Well, you mentioned learning. I love to learn, and I don't have all the answers, and I don't pretend to. Like I said, I learn something new every day, and that's why I love this job, is because I love people. I love working with people. I love making them better. What you mentioned is a common complaint about the numbing, the apathy. We see that with SSRIs more often, but we also see it with SNRIs like Effexor or Prestige. The simple answer to that is that we need to treat completely. So what I would do in your case, if Effexor is working for you, if it's lowering your anxiety, if it's helping, but you're numb, I would add Wellbutrin. So with Wellbutrin, then I would boost dopamine in your system, and that right. So I call Effexor Wellbutrin the dynamic duo, because most of my practice, my whole practice is medications, but I'm really, really good at learning how to find the right fit for the right person. And if it's the wrong fit, we take it away. If it's the right fit, in other words, if you're seeing some results with something, and let's say it takes you from here to here, we want to get you to here, you take this away, and then of course go back to here, which is fine. People say, well, I'm surviving. I'm not loving how I'm feeling, but I'm surviving it. And I'd rather feel than non-feel, like you said, but it doesn't have to be one or the other. It's just a matter of learning how to complete the medication. And people don't want to be on medications often. And so talking someone into being on more than one thing is not always easy. And they
right.
say, but if I explain to them, this is why I think adding this is going to make you feel a lot better, because, this is doing this is doing that. So I explain patients, I draw neurons and, which are nerve cells, and I explain exactly with patients what medications they're doing, how they're helping with the nervous system fire better. And so I'm explaining to patients exactly what I'm doing each step of the way and why I'm doing it. And the goal of treatment really is, we call remission, which means returning to your full self. So full self, what I ask patients the first visit is, tell me about when you felt the very best in your life. When was that? How old were you? And people will either tell me the different answers. Sometimes it's like a year or two ago. A lot of people say late teens, early mid-20s. That was a good time, before life got more complex and life was simpler. Elementary school is a common answer, before puberty. You have fun, you play with your friends, and then life gets more difficult. So when I ask people when I think they're at the place where I want them to be, that you feel back to your old self again, and if they say yes, great, I've done what I need to do. If they say almost, I ask them, well, what's left, and let's work on that. So that's the goal of treatment, because when we balance neurochemistry, and which is what medications are doing, it recreates the real person. And people might think, well, isn't the real person off medications? Well, yeah, you could say that, but you could always say that with the diabetic. It's like, well, isn't the real you off of insulin? And the diabetic is going to say, well, no, it's still the real me. I'm still the same person. I'm treating my diabetes. Same with this, people might think it's different because there's no blood test for this. And this is a common thing I hear. There's no blood test. There's no scan. There's no proof that what you're doing is working, or what you're doing is necessary. And what I say is the proof's in the pudding. I mean, the proof is the results. In other words, if medications are, if they help a person, it means that they're balancing the person's neurochemistry properly. And if they don't, if that's not the problem, they're not going to help you. And then we have to look elsewhere for answers. Not that there's, because we have other answers like psychotherapy, and I always talk about exercise and talk about healthy living and learning how to relax and learning how to breathe. And I mean, so all those things are important. It's not just medications, but medications do play a central role, and they're very misunderstood. And there's a lot of people out there, a lot of podcasters, a lot of bloggers who are very anti-medication, but their opinions are not educated opinions. They're not based on science. They're based on their opinions. And the opinion will be like, well, everyone's stressed out and everyone gets depressed and everyone, well, yeah, we get sad, we get bummed out, we get stressed. But if it's a persistent problem that's really affecting the person's life in a negative way, well, then that's maybe something to look at.
I've gotten off all my medication, but I've also gotten healthier in my mind. I took myself off because, again, I wanted to feel, and the feelings that I had are tormental. Like, they're horrible. Death. I mean, they're just death thoughts. And I can walk myself in that position, whether I'm on medication or not. The question is, do the medications inhibit the ability to move forward and deal with the things that because generally, and this is my own observation and the people I talk to, I had hundreds of people, and it's about the same thing. There's some sort of trauma in the past. And when we start dealing with that trauma, we start dealing with those things that are in the body, actually start focusing on releasing this pressure in our body and even in our mind, we tend to get physically better, healthier skin, like our body starts to heal itself. Our mind starts to heal itself. And I don't know that I could have done that with medication. Now, that's me. I'm talking about me. I don't think I could have done that with medication because I was just so apathetic. Even while I was in talk therapy and it was helping, it still, as soon as I stopped doing talk therapy, I'm back to the same thing. So the question for me, and I'm even going through this right now, is balancing the entirety of my life. So exercise, food, prayer, meditation, finances, really looking at this in a way of needs, desires for my future, for my present, and then who do I want to be? So, but I've only gotten there through suffering, severe suffering. And fortunately, I'm coming out the other side, and I'm, finding the value of life. So talk to me about that a little bit, because I am a little bit anti-meds. Now, I wouldn't say somebody shouldn't take meds. That's not my job. I don't know. I'm medically not. I'm saying I shouldn't take meds. I am diabetic, and the more stuff I put in my body, the worse it gets for my kidneys. And, that's just my, what I've briefly read. So even an uneducated decision that pharma meds will eventually break down my system in a way that if I would have just eaten better, exercised, drank more water, stuff like this. So how do you take a holistic approach, like with people, especially in the psychiatry field, and trying to heal their mind and their body?
Because I also, believe in everything you just said, and I talked to all my patients about what you said. Contemplative prayer, relaxation techniques, learning how to, but exercise is huge, very key. Eating well, exercise, so being healthy. But I look at holistic in a way. I've defined the term helping your body heal itself, and psychotropic medications, that's how I look at them. I look at them as holistic. If you knew what they're doing, and if I had a board and a diagram, I could explain. But basically, what's happening is that, there's over 100 billion nerve cells in the body, and there's over 100 trillion connections we call synapses. So chemicals are traveling from one cell to the next on a constant basis, about 1,000 times a second around the body. The problem becomes, and this is proven, there can be leakages on the cell membrane, so the chemical that should be going this way forward end up going backwards. So because the medications are reuptake inhibitors, they inhibit the reuptake, which means that they stop the chemicals from going the wrong way and they force them to go the right way. And that's what they do. And so that's what I call holistic, is because it's recreating a normal flow of chemicals in your system. Now we got to look at what's causing the imbalance of the flow. You mentioned stressors. That's number 3. That's the third most common reason. And our tendency is to focus on that. Number 1 is genetics. So if I asked you about, I don't know you, so I've asked you about your mom, your dad, family history, I'm guessing you have some significant family history. Am I right?
Mostly traumatic. As far as like
no alcoholism, nothing like that.
Oh yeah, alcoholism and drug addiction on my mom's side.
Right.
Pretty heavy.
And so that's self-medicating. So a lot of it, we're going to see family history is number 1, genetics. Number 2 is hormonal changes. So this is going to happen to people. This is why I mentioned puberty is not usually the best time for people. 40s, 50s, midlife, with women after pregnancy, so there's hormonal changes, and then stressors, trauma, there's a lot of trauma out there. And so it's a combination of those 3 factors coming together. Some people have no trauma. They have 0 trauma in their life. Everything's great. I mean, some of these famous people that are rich, and you think like, what problems would they have in their life? Come on, why are they depressed? They have no reason to be depressed. Why would Robin Williams hang himself? That makes no sense. Isn't he always funny, and isn't he always happy all the time? And it doesn't make sense. Why? Because it doesn't have to make sense. It's because of the fact that it's something that the person can't help. They can't help that they feel that way. And so you could basically, one option is what you just said. Just if someone doesn't want medication, then go full force into like everything else besides that you can do to help yourself. But medications, when I explain to people what they're doing and how they can help, and then try them. I mean, I tell people, let's try them. If you don't like them, we can stop them, but if you do like them, because of the fact that you need to be on a combination, not just one thing, it's usually most of my patients about 2 or 3 things to get them from out of depression, out of anxiety into like a good state. It's 2 to 3 usually. That's average. If someone's more complex, bipolar, maybe 4 or 5, even 6 meds at some point, and some people are more complex. But it's all about learning how to combine, and a lot of doctors just aren't very good at that. They'll put someone on an SSRI or just Effexor, and they'll stop there. They don't know what to do after that.
Yeah.
And then people get the numbness and the sexual side effects and all that, and they're like, I don't want this. I'd rather feel like I did before than feel numb. Again, it doesn't have to be that. That's just if it's a numbness, it's a doctor who doesn't know what they're doing. They don't know how to follow up. Maybe they're dosing it too high. Maybe they don't understand that we need to do low doses, not high doses often. So it's just the art of it. It's just the art of learning how to prescribe properly.
So is it long-term goal, or are you trying to do like say 2 to 3 year stint where you're working with people to get them in
it's a good starting point of like 6 to 12 months. It's a tough question to answer. It's very individualized. If it's trauma based, so let's say someone goes through a really difficult loss of a loved one, and they're grieving, and you can't really medicate grief, okay? But let's say the grief ends up lasting like to the point where it's really affecting their lives, and they have no genetic and no history before that. That's a person that might benefit from maybe 6 months worth, and then take them off, kind of get everything rebooted in a sense.
Yeah.
Now, if it's someone who said, this has been all my life, I've felt this way, or most of my life, and they have really strong genetics, and they have, really strong hormonal elements involved, like menopause from women or menopause for men, then that's a person that probably longer, and the only way to really know the answer to that question is to take someone off of things and see how they do. There's really no way of measuring it other than just removing them and reassessing,
So, and maybe you've answered this, but I didn't understand. What's the controversy behind off-label?
What's the what?
What's the controversy behind off-label?
I love that question. I could talk off-label all day.
What is off-label? Just
off-label basically means using a medication for a purpose that it wasn't originally intended for. Gotcha. For example, a common one in what I do is an antidepressant, using it for an anxiety disorder. And it's not indicated for anxiety disorder. Does it work for it? Oh, hell yeah. That's why I do it. But is it indicated? No. And so the FDA and the DEA, they're very, very strict about, with pharmaceutical companies, how they label things and how they market things. You cannot go beyond what they marketed it for. We doctors figure it out. We doctors who work with medications figure it out very quickly that, oh, it's not only good for this, it's good for this, this, and this. That's all off label. Oh, this is good for fibromyalgia, where there's no medication, there's no indicated for fibromyalgia, but does it work for it? Yes. So that's what off label is. Off label, in my view, means cutting edge medicine. It's the cutting edge of the field of what I do, is learning how to prescribe off label. Off label is great. It's amazing. It's now, do most doctors understand it? No. Do they know how to prescribe off label? Unfortunately not. This is my goal, is to get the word out there. This is why these 2 books I haven't released yet, I'm working on now, because I want to change I want to change things out there. I want to educate. Hopefully that answered your question about off label?
Yeah. So let me ask you this. Have you considered, or what do you think about the up and coming natural medicines like psilocybin, ayahuasca, the things that have been around for thousands of years that we're just now reinstituting into our culture? What do you think about those? Like MDMA, ketamine.
Yeah. I have a TV show out now. Maybe we'll talk about that in a bit, but I have a TV show out, and I had a guest on who was a psilocybin specialist. I had a woman, he's in the East Coast. I had a woman come on, I call him the Mushroom Man, interview. And I have a woman who specializes in ketamine. So I talk about this on my TV show, the Dr. Paul Show. But yeah, I think it's definitely, I've seen evidence that these things work. There's no question. I've seen all that. There's also something called TMS, which is, like a machine you sit in and it kind of tries to rewire your brain. So that's a good option too. So for people who are breaking through, antidepressants aren't working, or some might say, like, I don't want to take antidepressants, I'll just do psilocybin. That's great. It can work. A quick example, I have a patient I saw who was here with his wife, and I had tried everything I pretty much could with him medication-wise. And she said, he's a lot better than he was. But she said, just look at him. The spark's not in his eyes. He just doesn't have that spark he used to have. And I didn't have any other answers. And I said, you know what? I don't know too much. I've heard about psilocybin. I don't know. It's not legal formally. You have to kind of get it underground. Right. But I said, if you research it, there's psychologists that work with it. Anyway, I saw them back a few months later in the office, and, they had met with a psychologist, worked with psilocybin, and she says, like, look at him. The spark's back. The spark's back in his eyes. He's golfing with his friends again. He's out being active. He wasn't doing that before. He wasn't depressed, but he was just sitting around not doing things. And now he's out. He's his old self again. So I've seen it in action, and I've seen it work. And the same with ketamine, I've seen it work. And I know Elon Musk famously is on ketamine, and it seems to work for him, he says. So I think that there are alternatives besides medications for sure. MDMA, same thing. I'm a fan of whatever works for people. I I had a guy come on my show who was a cannabis scientist, and he has a cannabis laboratory, and that's all he researches for years. And he is we talked about cannabis as some people develop, have some benefit from that. I have a very open mind to things, and some people might get upset with me for giving positive reviews to some of these things, but it's the truth. I'm sorry. I mean, I don't want my TV show to be all about just medications. I want it to be about the whole subject. You mentioned neuroplasticity. Anything that helps neuroplasticity, which psilocybin does do, and so does TMS, and so but again, also with psychotropic medications, they're also kind of doing that because they're kind of improving like the neural flow, and I think that it's shown that there's new connections being made, and so yeah, that's a key. But it's a fascinating subject. There's the psilocybin definitely very interesting for sure, and
Yeah.
you mentioned ayahuasca too. So
Yeah, and I know they're different experiences, and generally they say ayahuasca will visit while you're in a psilocybin journey. So it's kind of the mother of all that. So I did a psilocybin journey and it saved my life. I mean, it literally saved my life. I was within 2 days of taking my life. Had a plan, barely made it to the ranch that was doing the journeys, and 2 days later, I'm still, all the walls were broken down that I built in those traumatic situations as a kid. And now I'm able to re-navigate my life and rewrite that story instead of reacting to the outside world as I normally would. Now, is there some residual effect of that? Yeah, but that's nothing. It's not an all fix all. It's an opportunity to live. And that was the thing that, it was a Hail Mary for me. I was like, there's no way. It's not going to work. I have no recollection of anything good that I can even come up with. So I have no starting point. And it was really just about tearing down the walls that I built as a kid to protect me that were still in place as an adult, trying to protect something that wasn't true, that is no longer, I'm not getting beat anymore. I'm not getting molested. I'm not getting this or that. I'm an adult, and those walls, and that's where I'm like, okay, that's the body. And it's not the mind. It's the body just saying over and over and over to react and protect and fight. And now I'm like, I don't have to do that, which is amazing because I've done all the things. I did the exercise. I did the reading. I went to church for 15 years. I stayed sober for 17 years. I read and researched, and nothing worked. And I did the medications, nothing worked. And maybe I'm just too stubborn. I don't know. I mean, that was a very good possibility. But it really took an exponential amount of psilocybin to break those walls down for me. And really for me to understand what my true nature is as a human being. I'm not a jerk. I'm not mean. I'm not all these things that I tell myself that I might act out and people reaffirm. I'm more kind, generous, giving, loving. That's my true nature. It's just not expressed because the walls are built. So it's really interesting to see this. And as our mental health gets higher in rate or statistics, to see these things come into play and people starting to be kind of woken up to the fact that they are this beautiful being and they have opportunity, and they couldn't see that for so many years of their life. And now they're walking in something that they never expected, like myself. I never expected to be this or be on a podcast ever or be on video. It's just not who I am. I don't want attention. I don't want these things, but I know this life and I know this thought process. And I relate to so many people because of the things I went through, and coming out the other side, I'm able to walk people through that. And one of the things I've been doing, and that's that balance wheel, is I think that's really like, it's not that I don't struggle every day. It's not that I don't have pain or depression or anger or whatever. It's the more I do practice, the more I practice respecting myself, is what I call it.
Hmm.
The better I feel every day, and the more motivated I am every day. And even when frustrating things come, I'm like, that's not going to stop me today.
Hmm.
And instead of, oh, I can't do today anymore. And that's 9 o'clock a.m. You know?
Well, you're a strong person. You're a strong person too, and that helps for sure.
But yeah, and that's if you're alive, I think you have an incredible strength you don't even know you have. I think if you're living, you have more power and strength than you've ever been taught or told.
Hmm.
And that, and even if you grew up in a good home, you might not know how much you have. I mean, we're just fascinating human beings, and powerful and gifted in our own individual ways, each and every one of us. It's not one person is without purpose. The only reason we're without purpose is because we don't see who we are, right? I mean, that's what I'm thinking. The more I see my true nature, the more I will enter into the very thing that I was built to be and meant to be. And it's not necessarily based on a podcast. It's based on my internals and where that takes me. So yeah. Yeah, man. I mean, I love what you're doing. I love the books and the approach, and then the education for doctors. I think that's so important. Um, because oftentimes, you only get a few minutes. I mean, you're 15 minutes for a visit, and you
No,
have to
not
figure,
with me.
okay,
Um, a new patient, I block out an hour, and
nice.
for follow up, about 20 minutes for follow up. It sometimes goes longer, sometimes shorter. Um, but no, what's different with me is really good customer service. I think a lot of doctors, rush people in and out, and I have in my office. It's simple. I sit real close to the person. I'm in my chair. They're on the couch, and it's a very comfortable setting here, very small office, and so it's just I'm not on the computer typing while they're talking like a lot of doctors are doing, and um, so with me, it's spending time with people, quality time, and then doing things that doctors don't do, like returning phone calls every day. So if someone
Mm.
calls me, I return every phone call every day, same day. And what I do as a practice is every time I see a new patient, I have them call me in a week. So just give me a follow up phone call, because I'll be able to tell in 1 week whether what I gave them is the right one or not. I can tell that
Oh, okay.
quickly. So usually, and there's a myth that it takes 4 to 6 to 8 weeks for something to work, which has never been true. So I work quickly. I follow up quickly. I do a lot of free in between phone calls between visits. So I basically try to make sure people understand that I really care about their getting better, and I'm going to do whatever it takes for that to happen. But yeah, I think if so many doctors work so slowly, and it takes months and months for someone to see benefit, and people aren't going to hang around that long. Patients are not going to, they're going to get frustrated and drop out if they say, oh, this is, if you don't get to it quickly, and if something is not right, and if it's giving side effects, okay, let's stop it. Let's try this. Whatever the side effect is, by the way, it gives me a clue with, okay, now I know what to give you based on what you just told me about this medication. I think I know what the right one is now. And so I do that. I do that really quickly and get people better. Most people I get better within a couple weeks, 2, 3 weeks at the most. Between the first and second visit, most of my patients are better. So it's just a matter of knowing what to do and how to do it.
Yeah. No, I like that. That's awesome. What's kind of your upbringing? Why did you decide to go into the medical field? I mean,
I
did you have a pretty good upbringing with your family? And
very good upbringing. Good education. I just early on, even in elementary school, I've always loved science. I always loved math. And I think moving into high school, just still loving science, became a biology major at USC in Southern California. Just always thought, just always interested, and I wanted to be a doctor since I was 5 years old. Um, our family doctor, who delivered me actually, for my Christmas, I think it was my fifth Christmas, he gave me one of those like plastic doctor bags, those little kitty doctor bags, so
little operation.
yeah, and so I quickly self-medicated on the candy pills. And then I was going around checking people's blood pressure with the plastic instruments, and I just was, so I got the nickname Dr. Paul early on. And so Dr. Paul kind of stuck with me as a nickname. And so I think I always wanted it, and I just kept pursuing it. And then going into college, and I knew what I wanted to do. I started pre-med, so I knew exactly what I wanted to do. It's just something I always want to do. Why? I don't know. I think it's just, it's as silly as it sounds and as cliche. I want to really help people, and in my profession, I see every day how I help people. I see the results. I see firsthand what's going on, and I'm humbled. I love seeing people who were just miserable and now they're happy, and they tell me I haven't been happy for I don't know how long, like genuinely happy, I'm not fake happy, just happy, smiling, just looking forward to the day. And they said I haven't felt that in I don't know how long. So seeing that stuff happening over and over and over again over the years just keeps driving me to keep doing it. And now teaching is what I want to do next. I'd like an online training course for doctors, focusing on founding family doctors. In other words, having a patient come on, like a new patient, interviewing the person, opening it up to discuss, anyone else have any questions. Then when the person exits, then we all talk about what do you think the diagnosis is, what the treatment plan is. So basically kind of an online clinic that I run. And other doctors kind of seeing what I do and why I'm making this decision, and getting feedback from them. Maybe they have a better idea what to do. So that's what I think, a learning program where we all learn together. We all learn on people together, and learning it, not just book learning, but actually learning, because you only can read so much about this, but you have to do it. You have to do it to see. And for doctors, they have to get comfortable with things. And unfortunately, too many primary care doctors just don't kind of blow it off, and they don't do much. They maybe will do an SSRI, and then people don't like it and they stop and they don't know what to do after that. Family doctors should be doing more. It shouldn't be just psychiatrists. Psychiatrists are expensive. They're not always the nicest people, in my opinion. They're not always the most friendly. So people are already not feeling good. I don't want them to have a scary experience with a doctor who turns them off, and so that's why I think it's important for primary care to really take the lead role.
There's a clinic. I did a interview last season. I'd have to look it up. I'll send you the information. But they're a medical office that has a psychiatry office in the building as well. So if somebody's struggling mentally, they can get them into see a psychologist right away. And so they're instituting that too. And it just started, I don't know, 4 or 5 years ago, something like that. But an interesting practice that they're doing, but they're on the medical side and referring, brought the psychiatry in, where you're on the medical side and instituted or transitioned to the psychiatry. So very, very interesting how that's becoming, people are starting to awaken to it, that both things need to happen. And I think that's what I realized through doing the psilocybin. I'm always worried about what's going on in my mind and not really working on my body or my food or my meditation or my prayer life. And since instituting those, everything is starting to improve. Everything. Is it happening overnight? No. Will it take time? Yes. But what do I get to do? I get to stay in the day today, because I'm doing these things for the future. So it's a really ironic, and almost seems, I would almost say it's counterintuitive, but it actually makes sense to do the counterintuitive instead of laying in bed, being depressed, and you get up and you start moving and you start doing. And you do a little bit and stop beating yourself up for what you're not getting done. It's one of the big keys, at least for me, is like give myself grace enough to be a human and make mistakes. And I don't think oftentimes we give ourselves enough room in those areas. So we end up messing with our own mind and creating problems for ourselves. And that's where, I think Maybe some of those medications would be beneficial. I have no idea. Like you said, to get, in those temporary states where it's like, I don't know what's wrong. I just need to start moving, and you just can't, because you're debilitated by the thoughts and the chemical imbalance. And it's amazing. When I did this psilocybin, you can almost feel the neuroplasticity. And what I mean by that is, I don't know if I can feel it or not, but my responses are different coming out of my mouth than my body. So my body's trying to react, but my mouth is saying something different than it ever has, because the mind is calm, but the body is reacting. So, and now it's starting to, balance out. I feel it kind of balancing out in my body, where that's starting to peel away and starting to recreate new memories in there. So it's really interesting how this works. And the whole physiology of the body and the mind, and it's just crazy. So,
and if I hadn't started in primary care, I'm not sure that I would be talking to you right now. I don't think I'm not sure I would have written any of the books. So if I would have done a psychiatric residency training program, I think everything would have been different. I think I would be like every other psychiatrist. We do what we do, but I think this whole physical mind body situation, it only happened because of my training and the uniqueness of transitioning from a family doctor to basically a psychiatrist on my own. It's just a story that I've never heard before. And I'm sure there's got to be doctors out there that have done it. I just don't know them and haven't heard of them. Sure. So it can't be just me, but it is a very unique story.
Well, and they haven't written any books either. So
right. Right.
So that does make you the pioneer. So
yeah, then finding that doctor who's written 6 books, that's true. That's a good point. Yeah, yeah, it's been a long journey, and I'm just glad it's almost over. That the writing journey is almost over. This year, I'll be finishing with those 2 books this year, and then get those done. I plan on. I'd love to travel and do speaking, around the country and to primary care groups or training programs. I'd love to get into that kind of thing. To maintaining practice still, maybe doing it virtually, my practice while I'm on the road, but trying to get out there and spread the word.
Yeah, that's awesome. So tell me a little bit more about the Dr. Paul show. That's on, we talked about it before we started recording a little bit, but it's on Roku, Amazon.
Yes, Dr. Paul show is the Dr. Paul show. It's on Roku, Amazon Fire, which is, I guess, the Fire Stick, whatever that means, and then YouTube. So Roku, I've got, I think, over 7 million worldwide views so far.
Nice.
On my YouTube channel, that's a newer thing. We've had over 10,000 views on that. If someone wants to find on YouTube, you have to put the Dr. Paul show, like all stuck together, one word, so no spacing between the words. So it has to be one like long lowercase, THEDR PAULSHOW. So if you enter it just like that, there's a free YouTube channel. And not only do I have all my TV shows on there, which we've now released, I think 36 of them or 37 maybe. We're in our 3rd season with 16 episodes per season. We're on our 3rd season, and there's a lot of short, like 5-minute videos on my YouTube channel. If people want to look at like briefly about depression, anxiety, ADD, bipolar, PTSD, all these other things I talk about on the show. And I have a lot of guests. So most of the show is people coming in my office and interviewing them, getting their backstory, telling their story, how they progressed till now. And so there's that. There's a lot of like a lot of some Zoom calls, and then interviewing people. I had a pastor came on talking about contemplative prayer. I had a psychologist come on. I've had, so I just want to get all the different viewpoints about ways of, not just, it's, again, I don't want it to be just medications.
Right.
It's not my point.
Yeah. Yeah. It's about healing in general, I'm assuming, and using the most effective modality for that. Mm-hmm. Would that be the correct term? I think that's the correct term. Yeah. Yeah. Well, Dr. Paul, thanks for being here. Is there anything you'd like to leave us with? We'll put all your links and
Yeah.
Anything that you want
I
to?
wanted to announce my new audiobook. I now I have the Corona Protocol in my audio. It's on Audible, Audible. So on Audible is my new audiobook of the Corona Protocol, and it's on hardcover, softcover, and ebook on Amazon, Barnes and Noble, and Walmart. And so those are my books. And my first three books, Healing the Mind and Body, the trilogy, are available on Amazon.
Yeah.
And so but that's right now what's going on. So
Well, thank you so much for being here. I really appreciate it. I really appreciate the information and the work you're doing. I mean, I love it when people find passion and find their passion. Fortunately, you didn't have to go through all the trauma to get there. I love it.
Yeah.
There are people out there without that. So it's good, man. Thanks so much for being here, Dr. Paul. I appreciate it.
I appreciate it.